Hi, everybody. It is another COVID open forum, and today is January 31st, 2022. We have several topics to go over and keep people updated on the latest of what we know around COVID. So I am going to turn it over to Gian.
Hi, everyone. So let's start with our current trend line. So good news there. We are seeing a downward trend across the nation, but particularly in our area. However, I still want people to be mindful when you log on to the CDC's website and you look at the map for cases, we're still in the red. So we're still in the high zone. But the good thing to note is that we are coming off of our surge that we had with Omicron. I think there will be different timelines for coming out of that surge across the United States, in particular, some of the Midwest and some of the West Coast. But, it hit New York, New Jersey, the East Coast kind of first, and also our DC area. So we are coming down, but we are still in the red. So meaning our transmission rate, because Omicron was so transmissible, is high, that we still need to continue all of our mitigation efforts that I know we've talked at, I guess at this point ad nauseum, but it is also human nature for us to drift. So continued masking, continued social distancing, continued with the hand washing, the disinfection, the cleaning of high touch areas. And also important to get boosted if you have not already done so. So you're eligible, all adults, for a booster if it has been more than 5 months since you received the 2 doses of the mRNA vaccine, or after 2 months of the J&J. If you did receive the J&J, the research is quite strong in that your efficacy will go up substantially if you do the mix and match. The initial studies came out of Europe because, one, they did not have a choice. I believe it was the AstraZeneca. Because of the lack of resources, some of them had to do the mixing and matching, but with that, we have some additional data. And the data showed that with that mixing and matching, it really helped boost their immunity. So something to discuss. If you have more questions with your primary care physician, if you have the J&J vaccine, consider getting the mRNA vaccine to get the additional boost. Also, and I think this is a very important data point, we're confused about why the booster is so important. If you have already completed your primary series, meaning the 2 of the mRNA and 1 of the J&J, we know that, now remember, in the beginning, when we talked a lot about the types of vaccines, how they were made, etc., the Omicron, the Delta variants were not here. So the vaccine that was created was for our wild strain and for our alpha and beta. So, with each variant that happens and as more mutations occur, it's just simple math. Of course, the efficacy will fall. What studies show is that, yes, it is still efficacious for hospitalization, for death, for severe illness. But for especially as we move further away with the Omicron variant, even if you're vaccinated with the 2 doses of the mRNA, it can fall down as low as 30%. So remember, we started off with being 80 to 90% efficacious. So that's a significant fall. If you receive that booster, it can take you up all the way back up to over 90%. So you're functioning in the upper 90th percentile, which is excellent. So that's the good news about the booster. That is why it is so important to get the booster. You know, again, our goal being we want to keep schools open. We want to be available for our students. Along with this, we've had a lot of updates because, you know, a lot has changed since we began the pandemic. We have more therapeutics available if you do get COVID, if you do get sick. And in general, many have been vaccinated. So our vaccine guideline, and in many ways, this makes it easier because, you know, those 14 days and 10 days of isolation and quarantine were very confusing for staff. Now it's 5 days of isolation and quarantine. So it's just 5 across the board. They add with 5 additional days of masking. That's more for places, for schools that don't have the mandatory masking. So at Phillips, we have the mandatory masking. So that would be a moot point, but we do need to take into consideration in particular certain students that are not compliant or have difficulty with compliance. So, you know, they would have to be looked at on a individual case by case. In general, those students should still isolate or quarantine for the full 10 days. But for most of us that are vaccinated, 5 days of quarantine. And just again, quickly back to the vaccine, where vaccines again play a very important role is in regards to quarantine. We know that with a lot more breakthrough cases are happening because we see, as I've just mentioned, that the efficacy can fall down to about 30%. So yes, there's going to be a lot more breakthrough cases, in particular if you have not been boosted. So obviously, if you are symptomatic, if you're sick, number one, of primary importance, we want you to stay home. You know, don't come to school and, you know, call me. Please stay home. The communication train, when you notify your supervisor, then they notify Jennifer for staff. Oftentimes, families will notify the school teacher, you know, please notify the supervisor, and that's a communication trail. So again, we've come down to now five days of isolation and or quarantine. The vaccination is in particular linked with the quarantine days. So remember, quarantine is if you've had exposure to someone that is a confirmed positive. So this is where your vaccine status really matters for staff. If you are fully vaccinated or received 2 doses of your mRNA or 1 of the J&J plus your booster. So this is where the booster really matters. And if you don't have any symptoms, then you do not have to quarantine. You can continue to come to work. You would just monitor for any symptoms. At any point, if you do have any symptoms, then of course, we want you to stay home. We want you to get tested. The 5 days of isolation. Remember, now this is when you have symptoms. If you have any symptoms that are potentially COVID related, or maybe a family member tested positive, so then you weren't having any symptoms, but that's why you went and got tested. So you can be either a symptomatic person with COVID, or you can be an asymptomatic, having no symptoms with someone with COVID. But either bucket, you're going to isolate for at least 5 days. If you were someone with no symptoms, then at the end of the 5 days of isolation, you would be able to come back to work as long as you had no symptoms. If you were someone that did have symptoms, and it could be anything, the cough, the sniffles, there are a couple of qualifiers that you have to be mindful of. one is that you have to be fever-free without fever-reducing drugs for at least 24 hours. The other variable is that in general, overall, whatever symptoms you had, that they're all improving. So if there's ever any question, we want you to follow up with your primary care physician. If there's one symptom, everything else is getting better, but you still have, the cough isn't getting better, then you are not meeting criteria. All of your symptoms in general have to be improving. And for staff, this doesn't really matter. This would apply more to our students who cannot wear a mask appropriately or keep it on. Then those students, again, a decision would be made on a case-by-case basis, but we would recommend that they isolate for the full 10 days versus the shortened 5. Lastly, about masks, I'm not sure. I'm sure it was probably something that came out in the media that all of a sudden confused people, and a lot of backtracking and confusion about masks. So I went back to my old notes, the video, and all the previous conversations we've had in this forum, and they all are current. They are all still valid. So to review, the masks that are recommended, we want you to have at least a 2-layer mask. A fit is important. If there's any looseness, especially around the sides, that's something to be mindful of. And right now, especially during the winter time with the weather being really cold, this was something that Piper had initially mentioned, doing the 2 layering. You can wear that surgical type of mask underneath and then a cloth mask on top. Great time to do that. That would provide you extra protection in that you would have a better fit, in addition to the extra layer. Remember, it should cover your nose, mouth, and chin. The gaiter types are still not good if you have a 1 thin layer type. And remember, the weave count matters. And even early on, we talked about studies that were done when there weren't enough masks. And these were done, it was out of a hospital in Texas, that used a very tight woven cloth with a filter in the middle. So it was 3 layers. And, when they tested those, they ranked just as high. It was above 95%. So there's a lot of variables that go into what makes a good mask. So just because it's a cloth mask doesn't mean that it is not as good. It can be just as good as a surgical type, sometimes if not better, if you've got that filter in between. Still, the types of masks with vents or that one-way valve still are not recommended. And if you're wearing a face shield alone, that is still not recommended. It has to be, you can wear the face shield along with a face mask. And some, I haven't seen these, but I guess, as we've gone along, there are some masks that have been made out of vinyl, so that would not be recommended. They are hard and difficult to breathe out of. Also wondering, I know certainly I'll call them fashion masks. They're very cute and pretty to look at, but oftentimes I find those to be very thin and usually a 1-layer fabric mask. So, that just wouldn't be optimal. But, just like if you've come to my CPR class, I say something is better than nothing. So wearing a mask, some type of mask, is better than not wearing one at all, especially when it comes to our kiddos. So the question about N95 masks. So the way CDC has articulated is essentially, if you have access to it, sure, then wear it. In general, does it provide better filtration than a surgical or cloth type mask? In general, yes. But it all depends. There's so many variables, again, that go into it. You know, in a hospital, you do fit testing. And if you pass the fit test, then you can be assured, yes, you're getting the 95% filtration. But, you know, in my experience, especially having a shorter nose bridge, or because they may have more sizes now, but, you know, when I was in the hospital, and it wasn't that long ago, there was only 2 sizes. You got small or large. So it's made for the masses. And when it's made for the masses, it's, you know, somewhere in the middle. So if you have a very short bridge, or if you have a very tall bridge, they tend to not fit you as well. And those are the folks that would generally fail the fit test. You know, they would have you jump up and down and see if you can smell, usually saccharin, some type of sweet odor. And if you did smell it, that would be a fail, because that would mean you have some kind of gap, some kind of a leak in your mask. So, and they tend to be a tighter fit. So usually for most staff, more uncomfortable. So if that means that you're constantly moving that mask around your face, taking it off and on, then, you know, you're not going to have that 95% efficacy. You know, so these are variables to think about when you consider your mask. Also, a lot in the internet about fake masks, fakes being sold. So I don't know. There's no way to tell on my end if you brought a mask to the office, like, is this fake or real? I don't know. I do know there's a lot of cheaply made masks that, you know, that a case that I bought even for Amazon for personal use, and it was so cheap, you know, it wasn't usable. So, you know, just use good judgment. There are certainly cloth masks that are very well made. And, you know, you can tell, you know, by the weave, by the stitching. So use good judgment. And I've heard over and over again, most pediatricians say for the kiddos, it's more important that they wear a mask, and that the mask be comfortable so that they keep it on.
Great. Thanks.
One other thing.
Yep,
yes,
go ahead.
Just last thing about masking is just reminding everyone, and I think this goes into the drifting, that we keep always a couple of extra masks on hand. You know, for people that have allergies, for people that sneeze and do a lot of coughing, if you have phlegm or mucus, you should be switching out your mask. Remember, when there's any moisture or wetness, it is less effective. I think that's the last thing I wanted to say about masks.
So if you are wearing it while you're exercising, I know when I walk and in this cold weather, I wear my mask because it keeps my face warmer. And we can wash our masks. I remember you telling us that at the beginning as well. But, you know, we have masks available for everyone. So feel free to switch it out. Can we talk a little bit about testing at school, and why, you know, what are the considerations with that?
Yeah, so now at this juncture in the pandemic, you know, like I said, things have changed. We're in a different position than we were in the beginning of the pandemic. We have vaccines available. In our small cohort, like the school, most of us are vaccinated. So, you know, this presents a very different scenario and how we plan mitigation around testing. In the beginning of the pandemic, it did make sense to have like a random sampling of testing for quicker quarantining, you know, to minimize transmission in our community. But at this juncture, what most public health officials are moving towards is, if available, to do test to stay. It is something that is currently available through VDH. However, there's still a lot of barriers that come even with that. You know, really, it's very time intensive. It requires extra staff. A lot of follow-up with identifying close contacts, following their symptoms, monitoring their symptoms. And even with that, you know, the parents would have to agree, they would have to consent for and sign a consent form to participate in testing. And then again, even when parents consent, you can have students still refuse. So there is just a lot of variables that goes in. It's not simply a matter of, can we get tests? We can, but in order to participate, we have to agree to following their protocol. And, you know, also part of the protocol entails, you know, for instance, if we had a close contact, one way to keep a student in school is to test them daily. So the parent would have to agree to test them every morning. And if it's negative, they can come to school, even if they're not fully vaccinated, as long as they're testing negative. You know, that would be the benefit of a test to stay, to keep them in school. But that requires they have good Wi-Fi. That requires, you know, for the parent to have the means to do that. So that would be an easier way for us to get the testing kits. Another, you know, obvious way is for us to do the testing within the school, but that brings in a whole another arena of barriers. Then we would have to get probably the CLIA, which is a waiver for laboratory, because we're dealing with lab samples. So we'd have to get clearance for that waiver. With the proctored kind of a test, with just giving out the test kits to identify close contacts and sending them home, all of that would be covered because those tests can be run by what they call a proctored exam. So you would log in, you know, you type in your name, your birth date, you would have a clinician at the other end who will walk you through that self-test kit. And that's one form of validation. When they do that, then they've got, that encompasses, that covers the doctor who will write the order and that laboratory issue. You know, if we're doing the test on site, then we need to find that on our own, or someone who will cover us. So that, you know, those are additional barriers that we need to consider. So that's a lot. And, you know, and I'm only just kind of skimming the surface of all the issues, you know, and the planning that would need to go into having testing at school.
Great, thank you. I know, you know, just like everything else, things change as we go through the process and as more information is gleaned and advanced and all of that. But trying, you know, when we were looking at the testing, you would be required to have a physician who would write the script, I guess, for every single test, and then they have to follow up with it. And we, you know, we don't have a physician, never had one, and trying to even find a physician to write scripts for EpiPens has proven to be next to impossible. So if anybody knows a physician who would like to volunteer for Phillips, that would be awesome. But it's not practical. And I think now with the availability of the tests through the government and testing sites and stuff like that, that people can avail themselves, you know, that way as well. So we can open it up to questions. We have more people than we normally have. So welcome everybody. And if you have a question, pop it in the chat and we will answer it. So we'll give you a minute to type.
And I just wanted to put out a reminder when it comes to staying home. Well, it's not a good reminder, but that leave, you're using your own leave at this point. The American Rescue Act and the act before did provide some funding to where that if you were out and you were diagnosed with COVID for up to 2 weeks, that you could get paid and the employer could be reimbursed for that. that's not happening. That ended in April of 2021, and Phillips did decide to keep that going through September of 2021. So, and that's when it ended. So I just wanted to remind staff that, you know, if you do get sick, you are at this point using your own personal and sick leave, which affects us all. I am on pins and needles and listening to see if the government does change this up, given the high transmissibility of this variant and probably other variants to come. So as soon as I know something, the whole staff will know whether we're gonna be able to change that around.
Great, thanks, Barbie. Mary did put in the chat, you can get tests. I think emails were sent out to all Phillips last week. If they haven't already shown up at your home, if you've ordered them, they probably will be anytime. My husband actually just used one. He needed to go see his 95-year-old mother. So it was, I think, pretty easy. I don't know how reliable they are. You know, if you're actually sick, you have symptoms, but anyhow, it's better than nothing. So any questions, clarification while we've got Gian also?
There is one
that
I'd like to answer about the orders. So does a physician have to sign off on every test? So in general, it would be a standing order that would cover all students, but I will tell you, most pediatricians, and I have reached out to even friends that were pediatricians, if they knew, you know, she went to GW, so I thought she may have some friends here. And there was great reluctance. I had no one, because they fear liability. Because you cannot control, because you say, if you test positive, you need to do X, Y, and Z. We know we can't control. We can't force people to go follow up or call their physician. And a regular pediatrician is not going to want to assume that level of liability with a school. So that's why it's not easy finding a pediatrician.
So I guess I'm confused. So in order for schools to have testing, a doctor has to sign off on that? I'm not understanding, because I know like schools have clinics going to different schools to do testing, especially when the Omicron variant.
Yeah, that's different. Yeah, that's different. Okay. If you have the health department coming to the school, and you know, for a public school system, there are different protocols for that. There are also different school districts, depending on where you are, that has a physician overseeing the school district. So, you know, you have a lot of variables, but when you have VDH coming to certain schools, they would be covered. The VDH has certainly their own public health docs there that will cover that order. Yeah.
So like in a private school like ours, you would have to have a physician ordering.
Yes, there is no, you know, for certain things, when different laws get passed, like the one that most recently passed is albuterol inhaler, there is now a standing order for albuterol for emergency use, that a physician, that VDH will allow a school to use their standing order. So a physician there has wrote a standing order if we do not have our own physician. They always prefer you to find your own. But you know, that's just the start of it. It's never that easy. And I did put in that request and I never heard back. Because you have to apply for all of these things. So, you know, it's just never an easy process. But so yes, we would have to find our own doc.
Yeah. So in terms of the testing, since we really can't do it, you know, in our school programs, the advice would be, if you have any symptoms, if you've been exposed to someone who's positive, to get yourself tested, to go to one of the many testing sites or access some of the free tests that are available now, and if you test negative, then you continue to do whatever it is you're doing and monitor for any symptoms, just like you would anyhow. If you test positive, then you follow the appropriate quarantine and isolation protocols.
I think the concern, well, for me, I think the concern was like after the breaks and everything. I know like a lot of schools did testing prior or required staff and students to do testing prior to coming back to minimize the transmission of the virus. So
no, you're absolutely right. And I know DC did that because it was all over the news. How successful they were, I don't really have a sense with that. And they apparently had, access to probably tens of thousands of tests to be able to put that into effect. The good news has been that overall we've had very few cases, knock on wood, and people have really done a great job of following all the protocols. As you all know, once we put the vaccine mandate in for August with returning for this school year, we had 98% compliance with that, which is why we are now mandating the booster as well, because as was explained earlier by Gian, and some of you may have come in after she did that, the efficacy of the earlier vaccines, whether it's the Pfizer, the Moderna, or the J&J, with these new variants, reduced as low as I think you said 30%, Gian. And so the only way to continue to stay, have that efficacy up in the 90th percentile or higher is to have that booster shot. So keeping safety of everybody in our buildings, our staff and our students, suggests that we, continue to require and keep up to date with whatever the boosters or the vaccines are as they develop, and if more develop, we'll go from there. So if there isn't anything else, and if there is, please speak up. Otherwise, we are a little over 4 o'clock, and we'll have another forum sometime in the next few weeks, no doubt.
One question that I have, Piper, is that we haven't been told when if a student has tested positive in our building. And as a therapist, I go into a classroom and there's only one student in the class, and I'm told all the students and the teacher were notified to stay home because they were exposed. But I did not get an email saying that those students, were exposed to COVID or any of them tested positive. And I know when I go and work in a nursing home, there is the need to know. And I feel like as staff in the building, we need to know, but we're not being told, and I'm not sure why.
Well, our practice is anybody who was considered a close contact gets notified and the close contact is more than 15 minutes with that student. And if you are vaccinated, then you don't need to isolate or quarantine. You would just be aware, just like with anyone else in your life that you may be in contact with. But I would certainly follow up if you have a question, and you see something like that, then go to your program director.
Okay, thank you.
Yeah, of course. Okay. All right. Well, thanks, everybody. Carrie?
Oh, I was just going to say, I think there's a question about whether Phillips would be in a position to provide some of the N95 masks for staff.
Yeah, if you can check in with your particular campus and ask for a N95, or I guess technically they're KN95s. You're not going to be able to see mine. Not the ones with the double, but the ones that go around your ear. They're actually KN95s. And they are washable, so we'd be happy to supply you with one, and they dry really fast. So yeah, just go. Yeah, and
N95 masks I would not wash. Oh. If you remember me saying that they can be reused up to 5 times. So as long as they're not soiled and in good condition, you can reuse them for 5 days. So you can have like a Monday, Tuesday, when you can label it, put it in a brown paper bag. They can be reused up to 5 times if they remain in good condition and unsoiled.
Okay, I stand corrected. Can you wash just the regular surgical masks? Yeah. Okay, yeah. So the KN95s 5 times and then dump them.
Yeah.
Okay. All right. So yeah. So see your probably your building folks who have access to the KN95s. And I don't think they're as hard to get. Peter, we have a pretty decent supply in Annandale.
I think Tracy just updated the supply for KNs. He also got some Ns, but as Gian mentioned, N95s are very technical, and to rely on some of their properties over time and things like that. I mean, they're one of the few devices like them that comes with an expiration date. So we tend to avoid that unless it's very, very specifically needed.
Okay, or double up on your surgical mask if that makes you more comfortable. But if you want the KN95, then go ahead and ask for one. And as long as we have supplies, we'll be happy to give them to you. Okay, I'm sorry. I don't know why I'm not seeing all these chats. It's not moving. Usually they move down. Did we answer everybody's question now?
I was just asking, can we provide each student with one, since we have students that use the other ones more than one day. I mean, we have to give them a new one. Yes, the surgical one. So is that something that we can provide them with, since they can wear it for up to 5 days?
Yeah, I would do the Gian, the surgical mask, unless you've got somebody who's got like a really small face and it keeps falling down and the KN95 fits better. I know that's a lot more comfortable for me. And also remember that early in the beginning, the 3D folks printed out the band that goes behind your neck, similar to orthodontic bands. And that will hold your surgical mask a lot snugger around your cheeks. And if we need more, if we don't have more at your campus, we can probably ask the 3D folks to print some more. But that actually is, it's pretty comfortable to use that. And then you have your mask nice and tight. But yes, we have masks. So do ask for them and get them when they're
students.
Yes. Mm-hmm.
For students, so I can ask the front desk, is there some specified the area where I would ask? Because I know when you ask for regular masks, it's kind of hard to receive that as well. So who would I ask and how would I ask? I know the comfortability and all that, but I would like to know where can I get it if I'm in the building.
All right, which campus are you with?
Laurel.
Yeah, okay, well, then we may, if they're not at the front desk, then we may need to ask Margie to put some up at the front desk. We can do that. Okay. I think our supplies are pretty good, and you know, we can continue to access more as well, so. Okay. All right, thanks everybody. Have a great afternoon, and we'll make sure those supplies get replenished up in the front of all the buildings. Okay. All right. Thank you, Gian. Appreciate it.
Yep. Thank you.